Hi everyone, thanks for listening to my presentations. Today I'll be talking about hepatitis B virus, but I'll be limiting myself to transmission and prevention. Later on, I'll publish presentation on hepatitis B virus symptoms, diagnosis, and treatment. The goal today is prevention of hepatitis B virus infection. That is all what I'm out to get. But that won't be effective, and we may not be able to prevent hepatitis B virus infection properly if we don't know the epidemiology and we don't know how it is being transmitted. So I'll be covering the epidemiology and transmission before rounding off with prevention. Hepatitis B virus infection is a universal health concern. Close to 250 million carriers worldwide, and annual death is about 500,000 plus. Though vaccination is helping, but it is still a big problem as per morbidity and mortality. Worldwide, there are about more than 1 billion people that will have evidence of hepatitis B virus infection, either past or present. There is a great disparity in prevalency. For example, it is low in Europe and North America. It is mild in Mediterranean and Asia. It is very high in Africa, with about 2% and about 5% and 8% respectively, meaning the prevalency in Europe and North America is about just greater than 2%, Mediterranean and Asia is about 5%, while in Africa is as high as 8%. Chronicity. Acute hepatitis B virus becoming chronic hepatitis B virus is greatest at about 90% in perinatal infection. That will drop to about 40% in infants and would also further drop to about 4% in adults. In other words, the younger you are, the greater the probability of having chronic hepatitis B virus. Transmission. There is the likelihood of vertical transmission, that is from mother to fetus, in utero or during delivery. It is more in high prevalence areas like Africa. Horizontal transmission means it's occurring early in childhood. That will be more in intermediate areas like Mediterranean and Asia. And sexually transmitted as the main source in low prevalence countries like in Europe and North America. Blood and behaviors. IV drug use or contaminated blood donation could serve as means of transmission. Percutaneous inoculation could also be the route in IV drug users, tattooing and ear piercing, and also through body fluids. Still on transmission, nosocomial or hospital-acquired hepatitis B virus infection is possible through procedures with contaminated devices or needle prick. Nurses, doctors, cleaners are not exempted. Transplant recipients like hematopoietic stem cell and solid organ transplantation could acquire hepatitis B virus infection. Still on transmission, skin breakdown or a cord in the membrane through toothbrushes, razors, toys, combs, nail cutter could be the root. And that's why it's important not to share all these items with anyone whose status you've not known. Breastfeeding. Mostly possible if there's a crack on the nipple. It is possible to have co-infection of hepatitis B virus with hepatitis C or hepatitis D. Now, prevention. Vaccination. Vaccination will be helpful before exposure in all newborns, all healthcare workers, any in contact with infected individuals, homosexual, HIV positive patients, hepatitis C infected patients. Post-exposure prophylaxis will be very helpful when there is a bite, a needle stick, or rape cases. Body fluids exposure to hepatitis B surface antigen positive, like semen of a person whose status is unknown, will warrant post-exposure prophylaxis. Baby delivered by a known hepatitis B surface antigen positive mother will warrant post-exposure prophylaxis, where the newborn should receive both the active and passive immunization, meaning hepatitis B immunoglobulin and hepatitis B vaccine. Safe sex practice. Use condom. If a spouse is having chronic hepatitis B virus, then we have to screen the partner. If the partner is not immune and not a chronic carrier, then the partner should be vaccinated. We will then verify the immunity by testing for anti-hepatitis B surface antigen in 2 months after vaccination. Percutaneous prevention. We have to educate on sterile equipment or tools, correct IV drug use habits. You can check my channel for street drugs. I have made publication on many of them. Healthcare workers. We have to immunize all of the healthcare workers. We have to minimize inadvertent transmission, and if there's any needle stick, we have to give both active and passive immunization if the status of the patient who had used the needle is not known. And of course, we have to carry out investigations on the patient also. Transplant recipients. How could we prevent hepatitis B virus infection in them? All we need to do is simple: screen the donors for hepatitis B surface antigen. And with that, I've come to the end of this short presentation. The next presentation will be on hepatitis B virus infection symptoms. Thanks for listening. Remember to share. Remember to subscribe. I appreciate it.